We're here at the Meadville Dental Center. My basketball coach in high school used to always tell me I had lead in my butt. So maybe this lead apron, I don't know, maybe I actually, now I have lead on my front instead of lead in my butt. But at any rate, we're here at the Meadville Dental Center today. We're going to talk about Sealant Saturday that happened here not too awful long ago. And we actually have some video right from this exact chair of a young man who was very excited to get his picture on TV getting his sealants on. So we're going to talk about that process. We'll also talk with our good friend Dr. Greene about the whole process of getting a sealant and what you need to know about that. So stick with us. We'll be right back. We're joined now by our friend Dr. Greene. Dr. Greene, welcome back to Medicine Meadville. You know, I remember when I was here with you last time, it was Veterans Day. Now I'm here, I'm wearing my red sweater today because it's Valentine's Day. So this must be like a regular holiday thing that we need to get together every holiday. So St. Patrick's Day, maybe we get together. Hey, those glasses you're wearing, by the way, what's up? What is that? Is that so you can like see things up close? And
they're a magnification system, 2.5 power. There's others more and less, but this works nicely for me. It's a combination of magnification plus still maintaining a certain field of view. If you get too high on the magnification, your field of view tends to disappear, and if you're working, you can't see what's going on around you with tongue in cheek, so to speak.
So we're not talking microscope here. We're talking about just make it a little bit bigger.
Right. As I tell, especially little kids, with these on, it makes your teeth look as big as golf balls, which it does, and it's good for finding detail.
Speaking of little kids and teeth, recently we had Sealant Saturday here, and I was pleased to come over with my little camera and get some footage of some of the work that was going on. Talk us through that there. Let's say I just fell off of the spaceship from Mars and I never heard of a sealant. What is it? Why do we do that?
Sealants are a technique devised way over 20 years ago to prevent bacteria from making egress into tooth surfaces. When our teeth are developed, and it's not true for everybody, but to varying degrees, there are little folds in the tooth structure where
what's the purpose of that?
And sometimes they join nice and even, and sometimes they're very deep and steep.
So if I'm designing that, Duane's designing that, I'd have thought flat would have been good. But why are there little knobs, and what's the purpose of that? Is that for grinding your food up? Is that why your teeth are designed that way?
Well, there's the biological designs, and that is part of the masticatory system, so that you have little hills and valleys in the teeth, somewhat like gears in a machine that work together to help you chew your food.
So the gears on the machine, as opposed to flat on flat, it's going to make a little bit more efficiency of chewing up that food.
That's correct.
And each person has those grooves in different patterns or whatever. That's going to be
everything's
that's a trouble
individual.
That's a trouble spot where you may have the potential to get a cavity in that groove on somebody.
Yes, if you have a really deep groove, you can't even get a toothbrush bristle in there. So if you can't clean it, it's going to pack with plaque. And what is plaque? Plaque is a biofilm, saliva, bacteria. And they have themselves a happy holiday there at your expense, eating what you eat. The only problem is the byproduct of that behavior is an acidic secretion which pulls calcium away from the walls of the tooth. So
when you come in for your checkup every 6 months, you guys are going to clean those things up and maybe have a fluoride treatment or whatever. But now what do we do in between the 6 months whenever we can't really get down and clean that up every day? Is that
well, even on my children, they had deep grooves. I knew they were going to decay. I put sealants on them. So what the sealants do, and especially with the youngsters, 6-year-olds, 6-year molars come in at around age 6. No mystery with that. And that's when we evaluate those grooves to find out, hey, could this youngster who has a susceptible groove be protected by having a sealant? Or has it, to this point, already gone too far where it started to decalcify, losing calcium, and now we have a cavity? So we have our little instruments that's like an extension of your finger, see, but it's very tiny, and we can feel. If we can't really catch into anything there except feel like a narrow groove, a sealant would be the best thing to do. If it's beyond that point, well, we're not going to do that. We're going to send him from the hygienist who does the sealants to the dentist, and then we will.
So now a sealant, not
care
a
of that.
filling. I mean, this is total prevention, not treatment for a disease,
Correct.
right? Am I saying
Correct.
that right?
This is a preventive measure, and it bonds to the tooth structure, and it bonds very well.
Now, our Dental Hygiene Association gets together every year and has Sealant Day, Sealant Saturday. And I think before on the show, we've plugged that to make sure folks knew about it. But if I have insurance, my insurance probably covers the sealants for my kids' teeth that would need it. If I have medical assistance, same thing, they're probably covered. But those folks who fall between there, maybe out in the cold, and those things can be potentially expensive. But the association is helping cover that. You volunteered your time that day. Our hygienist volunteered the time that day if the office was available. And I believe some of the companies that help make those products, if I understood that right, they've kicked in a little bit on helping to make that possible, to have the kids get those taken care of for free on Sealant Saturday. If I heard all that right that day.
Well, you probably did, and you probably heard more than I did.
Okay.
See, I'm not involved with the supply side of things, except if I need something. So we did have a great turnout. I think we had 10 hygienists who volunteered their time here, and about 25 youngsters we got through in 3 hours. Some of them got multiple sealants. Remember, one got 9 sealants.
Wow.
Because not only are the 4 6-year molars and the 4 12-year molars sealed, but also the first and second bicuspids. And I was just thinking the other day,
That's coming forward from the back. Is that what?
Correct.
Okay.
You got the eye teeth and the 2 bicuspids before the molars.
Okay.
And I was just thinking the other day, it's been years since I have filled an occlusal, a chewing part, in a bicuspid tooth. It's actually been years.
Why
The
do you
sealants work so well.
Okay.
Molars, if they're still not brushing properly, they can still get smooth surface decay. So the sealants are to help those who are have good oral hygiene, are trying to prevent tooth decay, and they just need the extra help there to help prevent that decay process
So
from
if I simulate my knuckles being those biting surfaces on the teeth, we're talking about in those areas, not on the part of the teeth that show, right?
Correct.
So does the sealant does it make my teeth look funny? I don't know how to say it in other language than that. Am I going to see it on there?
If it looks like anything, it might look like a little, just to use the vernacular, it looks like a little white nail polish following the groove.
But it's sort of going to be tucked down in there that you're probably
It
not.
will be down in the groove. That's its job, is to be down in the groove.
Cosmetically,
So-
I'm probably not even going to see that
No.
in any case. The part of it that might be visible is going to be the same color as the tooth for the most part. It's going to be
Or whiter.
whiter. Okay. In general, you've got to make a good checkup. The dentist has to make a good checkup before we
Correct.
seal
Gotta
the
make the
teeth,
call, right.
because we don't want to seal any problem in, right? Well, tell me, is that a possibility, or is that that's probably a bad thing if you sealed a cavity in there, right?
Yeah, you should not try to seal in decay. There's maybe some situations where that might, as a temporary fix, hold something off until further treatment can be rendered. But overall, if it's already decaying, we can't put a sealant on there. But once the sealant's on there, it will help prevent decay for many, many years. Sometimes sealants need to be redone, but that's rare. I mean, if you had them done on your 6-year molars when you were 6, and on 12-year molars when you were 12, and the bicuspids sometime in between there, then you'd have a total of 4, 8, 12, 16 sealants. There may be a case for resealing those when you're about 18, 20 years old, provided you have no other type of decay. Now, sometimes, if these sealants do tend to wear and break down, everything kind of wear and tear happens in life. So, if it does break down, often it can be and here's one of the keys: having your regular checkups. You can catch things while they're small. And sometimes if it starts to decay just a little bit where a sealant used to be, let's say you're in your late teens, early 20s, a lot of times we can just do a tiny little filling there that doesn't even require anesthesia. I mean, if it's the depth is the thickness of a fingernail, the surface is just roughened, maybe a teeniest bit of a discoloration, it's easy to get that right out of the tooth, put another bonded type of restoration on there that will hold that up, and you've prevented a, who knows, a catastrophic failure of the tooth and its subsequent extraction. So the sealants go a long, long way to really help preventing decay from getting a foothold through the enamel on these grooved surfaces. So that's basically what we're doing, is sealing in those susceptible areas so that bacterial progression does not proceed.
So now as host, I claim the right to ask one dumb question each show. So here's my dumb question. If I've already had a cavity on a tooth and there's a filling in there, does that one have to get, I mean, can I get more cavity, next to the filling? Do we have to seal that up somehow?
Well, the restoration that's in place should be intact, and the tooth should be sealed with that. Now, can you get decay around there? Oh yeah, you can. If you
that
don't
just means
brush,
more cavity, more filling on that cavity, so I can have two fillings in the same tooth, that might even touch each other? And
well, yes.
okay, okay.
There's
So we want to not get into that. We
there's
want to
like
get the
no
sealant.
limit to decay.
we want to get the sealants all cleared up first, so we don't get into that whole situation, right?
That is correct. And the sealants are very strong. And sometimes if the hygienist gets it on there just a little bit too thick, she'll have to call me in to smooth that down so that everything meets in harmony. And it's been my experience that those sealants are hard. I mean, I've been doing dentistry over 30 years and with various instruments, and let me tell you, those sealants are, you got to do a good bit of grinding to smooth them down. I mean, once they're in there and locked on, they are good.
So the sealant, better than drilling and filling, right? I mean, it's,
Right.
we want to do something up front to prevent a disease, because a tooth decay is a disease. I heard you tell me that once before, that we want to prevent that disease if we can.
Absolutely.
Well, Dr. Greene, thanks for being with us on Medicine in Meadville. Again, I'm sure we'll be back someday, but and thanks for volunteering on Sealant Day the other day.
It was a joy.
We have some footage of that. I think the folks will enjoy that, and we're going to talk with one of our hygienists that kind of talk us through that whole process. So I think folks will enjoy that. We'll look at that next. And joining us now is Liz Warlock. Liz, welcome to Medicine in Meadville for your first time on here.
Thank you.
We'll be nice. You'll tell me after. That
Take
was
it
really
easy on
okay.
me.
Yeah. Sealant Saturday, a couple weeks ago, right here in
Yes.
this room, we got some footage of a gentleman who was very excited about having his face on TV. So we got a lot of work done that day. But talk for a second about the Dental Hygiene Association who puts that together.
Yes, this is our 7th year doing it down in the Meadville, Conneautville area. The first couple years it was held at Valley Dental Center, and this was our first year at Meadville Dental Center.
So this was a freebie. I mean,
Yes.
the association, you guys all volunteered your time.
We volunteered our
The supplies
time.
were free.
Supplies are donated. Meadville Medical Center donated the facility, and Dr. Greene and Dr. Thomas always donate their time as
So
well.
if I've got insurance coverage, probably the sealant's probably going to be covered. If I have medical assistance, probably going to be covered. But there are folks that fell in between, so this
Yes.
helped them out.
Yes.
I saw a count after that there were 122 sealants done that day on, was it 19 or 29? Some number like that
Yeah,
of
in the
individual
20s,
kids.
yeah, yes.
So each one had several, and I guess just by counting that up.
Right.
Tell us for a second about when is the right time to have a sealant for a tooth. So that's a tooth that might get a cavity someday, right?
Yes.
And a certain part of the tooth that's more likely to get the cavity?
A sealant is usually placed on an adult tooth, a molar or premolar, and it's to prevent cavities.
So if I'm 5 or
usually
6 or younger, I
the
don't have
6-year molars come in.
6 years or older.
Yeah,
okay.
and then 12-year molars come in, and then the premolars come around anywhere from 9 to 13, somewhere in that area.
Well, talk us through it a little bit. Well, how do you do it? How does it work? What's the first step? What's the next step?
It's an easy process. It's a protective coating we put on the tooth to help stop the cavities. The first step is dry the tooth the sealant will be placed on. and then we place an etch on it. It's an acid solution, which roughens the tooth surface so the sealant sticks a little better.
Okay.
The etch has to sit on there 20 seconds, and after 20
Okay.
seconds we rinse it.
Kind of like primer on your walls. When
Yes.
you're going to paint the walls at the house, you got to
Yep.
put the primer on.
Roughens it up.
Okay.
And then we dry the teeth again, and then usually cotton or some other absorbent material is placed around the tooth to isolate the teeth and keep them dry. Then the
Okay.
sealant material is painted on the biting surfaces, and a curing light is used to harden the sealant material.
So the reaction is to the light. I noticed the light was kind of like a bluish,
It's blue,
kind of bluish
yes.
color.
Yeah.
Well, how does that work? What's up with that?
It's ultraviolet light that makes the sealant, which comes out like a gel, harden.
Okay. Okay. So that area where that sealant was put on the tooth, and it's on like the
biting.
the impart where the
Yes.
tooth's going to impact another tooth
Yes,
or whatever.
the biting surface.
That's not going to wash off. That's not going to come off. That's
Through the years it can, and
Okay.
also depending, that's why you want to isolate the tooth, keep it dry. If you have any moisture, it makes the sealant a little weaker. They do chip, they do wear through the years. You touch them up though.
So that area where I put that on there now, I want to make real sure, now I'm just talking here, I want to make real sure that I'm not trapping a cavity under there already, right?
Right.
So we want to have a checkup before.
Yes, prior
we-
to the sealant being placed, an exam is done by the dentist.
And just in general, just from the normal exam, we can make sure that tooth's okay.
Yes.
And so we're going to prevent that from getting a cavity
Yes.
down the road. Okay.
Yes.
What do I do to take care of that then after? Do I have to brush differently? Do I have to?
Nope, routine brushing, flossing, and come see us every 6 months.
Got to get your opinion on something too. The fluoride. Let's see. There's fluoride varnishes and there's
Varnish.
fluoride treatment when you
Yes.
come here to the office and
Yes.
whatever. Talk about that whole thing if you would. for a
Fluoride
second.
is so important.
Doesn't make your teeth whiter or prettier.
No, but it keeps them strong.
Makes them strong.
Yes.
Okay.
It helps fight cavities, and usually after our cleanings we do a fluoride treatment, which is a gel placed on the tooth surfaces, sits there for a minute, and then we use our suction to take out the extra. No food or drink for 30 minutes.
So this sealant doesn't impact that at all. This
No.
is going to prevent that exposure to other things that the fluoride is going to help with. It's going to
Yes.
prevent exposure in that area. I hear acids and sugars and stuff
Yes,
like
break
that.
the tooth down.
Okay,
Yes.
so this is going to stop all that.
Yes, helps.
Very good. Well, thank you for doing that. That was
You're
a great
quite
service
welcome.
to the community. 7 years now?
Yes.
And this year was the first time here
First
at
at
Meadville.
Meadville, yes.
First at Meadville.
The other years have been at Valley Dental.
How'd it go? I mean, when I was here with the camera, it seemed like it was going.
We had a
on
busy
pretty
day,
well.
yes.
Coming and going all day long, and people were happy. And there was no
Yeah,
drilling. Nobody was, squawking because it hurt or anything like that.
No, it's an easy process, and it really helps the teeth. If they had to pay, it is quite costly. It's anywhere between $80, $100 some for one sealant. So it's
So
a nice service.
Check your insurance. It's probably
Yes.
covered. If you
Yes.
don't have insurance, come on Sealant Saturday next year, right?
Yep.
We're going to do it again next year.
First Saturday
in
February, yes, 9 o'clock.
Well, thank you. Thank the other members of the association for us. That was a wonderful thing that was done, and I'm sure those families appreciated it. They sure seemed happy, anyways, when I was
Yeah.
here that day. So,
Yeah, it is a nice service.
well, just thanks. Thanks for explaining. Well, thanks for joining us today on Medicine in Meadville, and big thanks to the Dental Hygiene Association for organizing Sealant Saturday, and of course, as always, to our friend Dr. Art Greene for giving us his thoughts, and to Liz Warlock, the hygienist, that kind of talked us through the process. And thanks to you at home for watching us on Medicine in Meadville, as always, and join us next time.